Research out today reveals an alarming and growing health gap between Australians depending on how wealthy we are and where we live. It finds the rates of obesity are the highest they've ever been, and in the last 30 years we've reversed the gains of the previous 3 decades when it comes to differences in how long we live. With more, here's the leader of the study, Professor John Glover, who's the Director of the Public Health Information Development Unit at Torrens University. Hi there, John. So firstly, can you give us some examples of the differences in health and wealth around the country?
Yes, Ros, there's big differences in a whole lot of things. One of the pieces of data that we released just today was around obesity. Now, the Australian Bureau of Statistics had released figures saying the headline figure for overweight and obesity was 67%. This was released a while ago. And what we've done is release it in a different way and show it by areas across the country, between the areas with the 20% of the population who are living in the most well-off, most advantaged areas compared with the most disadvantaged. And there's a 56% difference in the extent of obesity in the most disadvantaged areas. There are higher rates of smoking, higher rates of diabetes, and then when we get down to the real meat of things and the premature mortality, people dying before 75 years of age, that's where we see again big differences, a gap of twice the level of premature mortality in the most disadvantaged areas. And this is 20% of the population. It's not just the unemployed, Aboriginal people, single mothers, other disabilities. It's across the whole population is showing a rate of disadvantage and a higher rate of premature mortality.
Twice the level, that is extraordinary. How much is our rising levels of obesity responsible for that? What else is going on?
Yeah, I think obesity certainly feeds into that. Many people who are obese will be able to keep some level of health, but it obviously leads to more diseases and to premature mortality. Smoking rates have come down a lot in Australia. They're down to around 14% now, but the range in some areas is much higher across the country. The levels of lack of exercise and physical activity are also quite striking, the differences. But again, it's also very much the difference that relates to employment, unemployment, people being able to afford to take the time to buy and shop and buy and make nutritious and good food, and who can go forward to go walking and to go to and have leisure time, as against people who are living in the edge of society and really struggling to meet the daily requirements.
Yeah. Let's look at a couple of the other issues that came out in your analysis. What's happening with asthma, for example? You found differences for this condition also depending on economic advantage or disadvantage. Now, asthma would seem to be something that you either have or you don't.
Yes, and asthma has got a number of drivers, and I think in different parts of the country people talk about different things, whether it's asthma related to dust mites and so on. But, you know, housing that's not properly insulated with very cold nights, whether that's in regional or remote Australia or in our capital cities in places that aren't rental places that perhaps aren't insulated as well, the rates do vary quite a lot. And people who are more disadvantaged are less likely to be able to afford the actual the preventers. They can afford perhaps some sort of medication, but the more expensive medications are less likely to purchase, and therefore they are more likely to suffer from acute asthmatic attacks, which could lead to emergency department or hospital attendance.
And another key indicator, John Glover, was psychological distress. What did you find there?
Yes, that again is quite high, and it's measured by the Australian Bureau of Statistics through a standard questionnaire, and it provides an insight into the extent to which people, it's a high or very high, but if it's very high, it's the sort of level of stress that people actually need to be getting attention and psychological assistance, assessment through a therapist. And at least if it's even high, you need to be seeing some sort of medical practitioner or health practitioner, because it leads to stress in life, it leads to other illnesses, and again, it's been shown quite clearly that high levels or very high levels of psychological stress lead to premature mortality.
These are pretty confronting results, John. Were you surprised by them?
I've been producing the atlases for Australia since 1990, and unfortunately things in some areas are improving, but in many areas they're not. When we look at data around single or women who've got low educational achievement, there are a few of those, and children growing up in families where mums have got low educational achievement, that is dropping, which is really great. Kids need mothers, role models to show them about the way and the pathway through education. But other areas like, while smoking rates are going down, the gap between those who smoke in the most disadvantaged areas and the most well-off areas is growing. The mortality figure I mentioned of twice, back in 1989, premature mortality rates were 40% higher among the 20% of the most disadvantaged population. Now they are double. So we're actually going backwards in that area as we are in some others. And things like obesity has grown enormously since 1995. The increase in obesity has been from 19% of the population aged 18 and over being obese to now 31% since 95 to 2017-18. And in the population who are of normal weight, that's dropped from 44% to 30%. So people are moving from normal weight to obesity, which is a real concern, and it's not stopping.
Professor John Glover, thank you.
Thank you.